The real causes of nerve pain and tingling in your feet or hands. Nerve pain and tingling in the hands or feet can be a frustrating and debilitating experience. Despite being a common complaint, many people struggle to identify the underlying causes of these symptoms, leaving them feeling helpless and confused. While it's easy to assume that nerve pain is simply a result of aging or physical injury, there are actually a variety of factors that can contribute to this uncomfortable sensation. In this video, we'll explore the real causes of nerve pain and tingling in your hands or feet. We'll delve into the physiological mechanisms at play, as well as some common risk factors that may increase your likelihood of experiencing these symptoms. Understanding nerve pain and tingling. Nerve pain and tingling in the feet or hands can be caused by a variety of factors. The most common cause is nerve damage, which can be due to conditions such as diabetes, carpal tunnel syndrome, or peripheral neuropathy. In some cases, nerve pain and tingling can also be a side effect of medication. Other possible causes of nerve pain and tingling include vitamin deficiencies, infections, injury or trauma to the nerves, and autoimmune disorders. It's important to identify the underlying cause of your symptoms in order to properly treat them. Treatment options for nerve pain and tingling may include medications such as pain relievers or antidepressants, physical therapy, or surgery in severe cases. Lifestyle changes such as exercise and maintaining a healthy diet may also help manage symptoms. If you are experiencing persistent nerve pain and tingling in your feet or hands, it's important to seek medical attention from a healthcare professional who can diagnose your condition and recommend an appropriate treatment plan. Medical conditions that cause nerve pain. Diabetes. One of the most common medical conditions that cause nerve pain is diabetes, especially if it is not managed well. High blood sugar levels can damage nerves throughout the body, leading to tingling or burning sensations in the feet and hands. Multiple sclerosis. Multiple sclerosis, MS, is a chronic autoimmune disease that affects the central nervous system, including the brain and spinal cord. MS can cause nerve pain in different parts of the body due to damage to myelin, which is a protective layer around nerve fibers. Shingles. Shingles is a viral infection caused by the same virus that causes chickenpox. The symptoms include a painful rash with blisters on one side of the body, which can lead to nerve pain that persists even after the rash has healed. Carpal tunnel syndrome. Carpal tunnel syndrome, CTS, occurs when there is pressure on the median nerve as it passes through a narrow passageway called carpal tunnel in your wrist. Common symptoms include numbness and tingling in your hand or fingers, especially at night. Peripheral neuropathy. Peripheral neuropathy refers to any condition that damages peripheral nerves outside of your brain and spinal cord. It can be caused by various medical conditions such as kidney disease, HIV/AIDS, alcoholism, and chemotherapy for cancer treatment. Understanding these medical conditions can help you identify potential causes of nerve pain in your feet or hands so you can seek appropriate treatment from a healthcare provider. Vitamin deficiencies affecting nerves. One major vitamin deficiency that can affect nerves is a lack of vitamin B12. This essential nutrient is crucial for nerve health and function, as it helps to maintain the myelin sheath that surrounds and protects nerves. Without enough vitamin B12, nerve signals may be slow or distorted, leading to symptoms like tingling, numbness, or weakness in the extremities. In severe cases, long-term B12 deficiency can even result in irreversible nerve damage. Another important vitamin for healthy nerves is vitamin E. This antioxidant plays a key role in protecting cell membranes from oxidative stress and damage, which can affect nerve function over time. Research suggests that low levels of vitamin E may increase the risk of peripheral neuropathy, nerve damage, and other neurological disorders. While deficiencies are rare in healthy individuals who eat a balanced diet, individuals with certain medical conditions, such as cystic fibrosis or liver disease, may be at higher risk for low levels of this vital nutrient. Per posture, repetitive motion, and trauma. Per posture, repetitive motion, and trauma are three major factors that can contribute to nerve pain and tingling in the feet or hands. Per posture puts pressure on the nerves running through your spine, which can cause them to become compressed and irritated. This pressure can lead to numbness, tingling, or shooting pains down your arms or legs. Repetitive motions such as typing, using a mouse, or even playing an instrument can cause inflammation of the tendons in your hands and wrists. This inflammation can put pressure on the nerves running through these areas, leading to pain and discomfort. Trauma such as car accidents or falls can also damage nerves, leading to symptoms of nerve pain. It is important to identify the root causes of nerve pain and tingling in order to properly treat it. Addressing poor posture with physical therapy exercises, taking breaks from repetitive motions during work activities, and seeking medical attention after experiencing trauma are all important steps in managing nerve pain symptoms. Lifestyle factors contributing to nerve pain. Lifestyle factors can play a significant role in contributing to nerve pain. One of the primary lifestyle factors that can contribute to nerve pain is a lack of physical activity. When individuals lead sedentary lifestyles, their muscles weaken and nerves become compressed, leading to nerve pain. Another factor that contributes to nerve pain is poor nutrition habits. Eating a diet high in processed foods and lacking essential vitamins and minerals can cause inflammation throughout the body, including the nerves. This inflammation can lead to compression of the nerves, causing pain. Finally, stress is another lifestyle factor linked with nerve pain. Stress causes an increase in cortisol levels in the body, which leads to inflammation and compression of nerves. Additionally, chronic stress may lead individuals towards unhealthy habits such as smoking or drinking alcohol excessively. Both have been found to increase nerve damage over time. Natural remedies for nerve pain relief. Nerve pain and tingling in your feet or hands can be caused by a variety of factors, including diabetes, vitamin deficiencies, alcoholism, and certain medications. However, natural remedies can often provide relief for these symptoms without the need for prescription drugs. One effective natural remedy for nerve pain is exercise. Regular physical activity can improve blood flow to the affected areas and help reduce inflammation. Additionally, stretching and yoga can help relieve tension in muscles that may be contributing to nerve pain. Another natural remedy is acupuncture. This ancient Chinese practice involves inserting thin needles into specific points on the body to stimulate nerves and promote healing. Acupuncture has been shown to effectively reduce pain and inflammation associated with nerve damage. Finally, certain supplements such as magnesium and alpha-lipoic acid have been found to be helpful in reducing nerve pain. Magnesium plays an important role in nerve function, while alpha-lipoic acid has antioxidant properties that protect against oxidative stress, which damages nerves over time. By incorporating these natural remedies into your daily routine, you may find significant relief from your nerve pain symptoms without resorting to prescription drugs or invasive treatments. Take control of your nerve health. Nerve pain and tingling in your feet or hands can be caused by a number of different factors, including diabetes, peripheral neuropathy, carpal tunnel syndrome, and even vitamin deficiencies. In order to take control of your nerve health, it is important to understand the underlying causes of these symptoms and work with healthcare professionals to develop an appropriate treatment plan. One common cause of nerve pain is diabetes, which can damage nerves over time due to high levels of sugar in the blood. Peripheral neuropathy is another potential culprit for nerve pain and tingling in the extremities. This condition occurs when the nerves in the arms or legs become damaged or injured. Carpal tunnel syndrome specifically affects the median nerve in your wrist, leading to numbness and tingling in your hand. If you are experiencing these symptoms regularly, it may be helpful to speak with a healthcare provider about potential treatments such as physical therapy or medication management. Additionally, maintaining a healthy lifestyle that includes regular exercise and a balanced diet can help prevent future nerve damage. By taking control of your nerve health now, you can better manage symptoms and improve overall quality of life.